Welcome to the Maternity Mentor. Today we will be talking about what you and your newborn will need in the hospital and how to pack for it. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Many parents start to get their hospital bags ready 6 to 8 weeks before their due date, but they often wonder what should be packed for the baby. Let's explore what you should pack in the hospital bag for your newborn so that you are prepared. Packing diaper care items is not necessary. Hospitals will provide you with the diapers you need for your newborn. You should only pack diapers if you feel strongly about using a certain brand or certain kind, like organic or cloth diapers. If choosing to use cloth diapers, most hospitals will ask you not to use diaper pins in the facility as they could cause injury to your baby. When it comes to diaper wipes, that can be a different story. Some hospitals provide the traditional diaper wipes, like the ones you find in your favorite store. However, some will provide a soft cotton cloth that you wet with tap water to clean your baby's bottom. I prefer traditional wipes myself because I think it makes it easier to clean meconium off and they're more convenient. You can call your local hospital to find out their practice, or you can just pack a large pack of wipes to use during your stay. Again, if you prefer to use special wipes like organic, you need to make sure you bring them with you. Next, we get to diaper cream. Diaper cream is used for diaper rash, which causes a baby's bottom to get sore and red. This rarely happens to newborns in the hospital. However, if using diaper cream regularly is very important to you, then you need to bring some along because the hospital will not provide any diaper cream unless it's medically necessary. Finally, you may actually want to bring an extra bag with you because you can take home any extra diapers or wipes that the hospital gives you. Many parents wonder if they should bring baby soap to the hospital. The answer is no. Most hospitals practice delayed newborn bathing. This is where the first bath is delayed until 24 hours of life. This practice promotes a healthy recovery from delivery and successful breastfeeding. For more information on delayed newborn bathing, please watch our video on this. We will link that in the description below. When the first bath takes place, the hospital has gentle infant bathing soap to wash your baby. If you want a specific soap like organic, you should bring that with you. Once the first bath takes place, your baby shouldn't be bathed again until the umbilical cord falls off, which is usually around 1 week of life. So no need to bring soap. Some parents want to use lotion on the baby's skin. This is a personal preference, but not necessary for newborns. Additionally, newborns can have very sensitive skin and will react to the perfumes in the lotion, giving them a rash. For more information on newborn rashes, please see our video on this subject. We will also link that in the description below. Hospitals will not provide lotion, so if you want to use it, please be sure to bring it with you. Finally, the bath for the baby will usually use disposable cotton cloths. If you prefer for a soft washcloth, please bring one from home, although it is not necessary. This might seem like it goes without saying, but make sure you bring your baby's car seat with you to the hospital. However, this is one thing you can leave in the car. Unless your pediatrician or nurse asks you to bring the car seat inside, the car seat is best left in the car because most hospitals wheel mom out with the baby in her arms, so the car seat isn't needed. Make sure to get the car seat installed and checked a couple weeks before delivery. Many fire departments and police departments will check car seats for free to make sure that they are properly installed at the right angle. Check your local community for more information. In addition to having a car seat installed, make sure you know how to adjust the straps for your baby. Hospital staff are usually not allowed to help you install the car seat or buckle the baby into the car seat, so make sure you know how to do it. Occasionally, you'll be asked to bring the car seat into the hospital for a special test called a car seat test, which is performed on premature and late preterm babies. If the hospital staff doesn't ask you for the car seat, don't worry about it and leave it in your car. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about clothing for your baby. The first day in the hospital after birth and before the first bath, it's honestly best to keep the baby naked and skin to skin with mom as much as possible. When the baby is not skin to skin, many hospitals will provide a small newborn t-shirt and blankets used to keep the baby warm. After the bath, many parents want to start dressing their baby. I recommend bringing 3 or 4 sleepers or swaddles if you do decide to dress your baby. Of these, make sure one is a size 0 to 3 months versus all of them being newborn size. Babies sometimes come out much bigger than we expect, and newborn clothes may be too small. Better to be prepared. Hats and mittens are not recommended for babies anymore because they increase the risk of sudden infant death syndrome or SIDS. Once your baby has been bathed, a hat shouldn't be used anymore, and instead, dressing the baby appropriately for the room temperature is enough to keep them warm. Mittens can come off easily and become a choking hazard. Instead, for babies who are scratching their faces, use sleepers with a roll-over cuff that covers their hands to prevent scratching. Socks are great at keeping babies' feet warm, but make sure they have a nice, tight, elastic cuff. Too often the cuff is so loose that the socks just end up falling off and ending up on the floor. I don't recommend outfits in the hospital because time is going to pass so quickly you don't need anything other than sleepers. That being said, remember to bring that special outfit for pictures and going home. It's a great way to remember and celebrate this special time. Remember to bring a going home outfit in 2 sizes in case your baby is big. Many parents want to bring special blankets with them to the hospital. I would recommend only bringing 1 blanket that you can use for pictures and going home. The hospital will provide you with plenty of blankets, so having your own blankets is just one more thing to keep track of. Burp cloths are also unnecessary because you can use the hospital blankets as burp cloths as well. A definite must-have for the baby bag is a baby nail file. Babies come out with very sharp nails and they tend to put their hands by their faces because they did that in utero. Pretty soon they're scratching their cheeks and face. You cannot use nail clippers to cut babies' nails for a couple months. Instead, you need to use a nail file to safely care for your newborn's nails and prevent scratching. Hospitals do not have and will not provide an infant nail file, and you cannot use an adult nail file. So make sure to pack a baby nail file in your bag. Have your pediatrician's information in your bag or on your phone because the hospital will be asking you for this information. If you're planning on bottle feeding, you do not need to bring bottles with you. The hospital will provide you with the formula that you need to feed your baby. A lot of parents bring their breastfeeding pillow with them. I think it's a good idea to have it in the car, but wait to bring it inside the hospital. Many hospitals have breastfeeding pillows available that are hospital grade and can be sanitized between patients. Plus, sometimes you won't need a pillow at all to latch and breastfeed your baby. Best to wait and see if you need it first. Throw a couple pacifiers in your bag if you plan to use them in the hospital. While pacifiers are recommended by the American Academy of Pediatrics, once breastfeeding is established, they are usually not recommended in the first few days of life. This is so breastfeeding can be established before introducing the pacifier. Therefore, many hospitals will not offer or provide a pacifier. If you would like to make sure you have one available, bring one with you. Finally, if this is not your first baby, make sure to bring the big brother or big sister gift. It is often recommended that the new baby give the older sibling or siblings a gift. This is especially true for toddlers who may feel jealous. This can help the older child learn that the idea is the new baby is their friend who loves them, and this will often warm up the shy sibling to their new baby. Packing your newborn gear ahead of time for the hospital can leave you feeling prepared and confident. I hope this has helped you decide what you need to bring to the hospital for your newborn and what can be left at home. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember, share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.